A warm welcome to your favorite show, iMed. So we discuss many areas that will concentrate you on your health. So we need the spiritual well-being, physical well-being, mental well-being and social well-being in order to develop a good successful lifestyle. So while containing and while controlling all those things, we need to concentrate on some specific disease conditions, because diseases might occur, might not occur. We can't expect them. So in certain cases we need to know some outline causes of specific disease conditions. Might you not be caught with that disease, but sometimes one of your close relatives, one of your family members, if unfortunately have this type of a condition, we must be able to treat them, we must be able to protect them and look after them. So with iMed program, we are going to concentrate about Parkinson's disease, and to do the honors with us, we do have Dr. Kumarange Vithanage, consultant neurologist and senior lecturer of the Faculty of Medicine, University of Colombo. Thank you, madam. Thank you very much for joining with us. So madam, today we are going to discuss about the Parkinson's disease. Actually, what is this Parkinson's disease?
Yeah. So Parkinson's is a neurodegenerative disease. So what is neurodegeneration? So degeneration means cell death. So Parkinson's occurs as a result of cell death of brain cells which are responsible for movements in our body. So this is a condition which is progressive and irreversible, and as a result it affects our movements.
Right. Madam, degenerative means, like, I think for the ordinary people, how it occur and what is that degeneration, madam?
Yeah, so degeneration simply means that there is irreversible and progressive cell death. So sometimes, like we see in our body, if a cell dies, it can regenerate. It can come back to normal, but these conditions occur with age,
right,
due to death, which cannot be brought back to normal.
Right.
They will not gain their function back, they will not gain their normal structure back. So basically we lose these cells permanently.
Right. Okay, I think that is clear for you. If we have a cut or a certain wound, it gets cured, the skin grows, and the sensations, the temperature, the warmth and everything that we felt previously might be good. But if it is a deep cut or something like that, if nerves are damaged, it might not be the proper scenario and the ordinary cause that is dealt with. So in this case, the degeneration occurs, it might not return back to normalcy. So madam, like when it comes to this Parkinson's disease, can you just explain, because some people might not know the causes of this particular disease, so it's better for them to have a big understanding about the causes.
Yeah, so the definite cause is people don't know what the definite cause is. But anyhow, now this cell death, we talked about cell death, which is permanent irreversible cell death. In Parkinson's, this cell death occurs in the specific cells which are responsible for the production of this neurochemical known as dopamine. So as a result, our body gets depleted of dopamine. So dopamine is very important for these normal body movements. Like we should be able to walk the way we want at any time that we want. If we want to take something, our arms should function properly. And if you want to talk to somebody, we should be able to do so. So those are all our movements that we do voluntarily. So dopamine, it's an important neurochemical which is needed, absolutely essential in our body to execute these motor functions. So the cause for Parkinson's, therefore, is this depletion of this principal dopamine neurochemical.
Right. Madam, you said that some voluntary, involuntary condition. With this dopamine, only this that intended movements, that means if we want to take this pen out, like we want to move the hand, that is like if we can control it from our own. So there are some movements that occur without our control. Will this dopamine effect for both or only for this normal ordinary movements?
No, it just affect for the involuntary, that is movements which are occurring without any voluntary control. So yeah, so dopamine is involved for those sort of movements as well.
Right.
And
so yes, madam.
So you mentioned about the cause.
Yes.
So one would wonder as to why these dopamine cells gets depleted. So this occurs with age. So as a result, we often see that Parkinson's disease is commoner in the elderly population, particularly over 60. But there can be a certain minority where Parkinson's present at a younger age. We call them young onset Parkinson's. In such instances, the family history may play a role. The family history is not so important for this common day-to-day Parkinson's which occurs in elderly. But if it's young onset Parkinson's, there could be an underlying family history.
Right. Okay, so when concentrating about the causes of Parkinson's disease might not be not known, there might be a family history, young onset, mostly adults can occur, but you must concentrate that the certain chemical change which occurs inside of your body that might not be seen to the outside, the normal ordinary movements that we can control and movements which are occurring but it's out of our control, they might all be affected from this disease. But when we concentrate about a certain specific disease condition, we always talk about symptoms for the ordinary movement disorder or inability to conduct these movements might be a major symptom. So can you just explain about the other symptoms as well?
Yeah, so that's an important question actually, because the ordinary people, it's a mandate for them to be aware of these symptoms, because still we see that patients with Parkinson's are not being diagnosed, and they might not feel that this is something which they need to seek treatment. They just stay at home thinking, attributing that to the normal aging process, which is not really so. So the main symptoms, if we have to talk about, one would get a tremor. So we see the tremor in around 60% of the patients. So the tremor is a rest tremor, like if you are doing some task, say like now I want to take this pen, but in that instance I may not get that tremor if I have Parkinson's. Whereas in Parkinson's, the tremor is a rest tremor. You get the tremor at rest. And this can get worse if you are anxious and if you are angry. In that sort of instances, in the middle of an argument, this tremor can become worse. And so where would you get the tremor? Commonly in the hand, on one side. You wouldn't get the tremor on both the sides in the equal manner. Right. It's on one side. Later on, it can involve the leg, again on the same side. It can involve the jaw, the tongue, but not the head. Right. So we see a head tremor, and people come thinking that it's Parkinson's. Well, the involvement of the head in Parkinson tremor is very, very rare. Whereas what is common in Parkinson's is to involve these hands, legs, jaw and the tongue.
Right. Okay. So you might be very clear about those explanations done by Madam Kumarangi Vidanage. Right. So when it comes to those symptoms, you must specifically spot on consider. You can't conclude a particular disease. The physicians are there to play that role. But what you have to do is that when you understand the underlying things, the symptoms, and you might search Google, because when you are suffering from a certain disease, you must study. You might study, and you are doing, because the technology, everything, it facilitates that you learn. But what you have to do is that with this knowledge, you have to explain that particular condition to the physician. So if you say that the head is involved, there's a head pain or a head tremor, in the simple words, if that is involved, it's a very rare condition. If you are saying the particular symptom to the doctor in a wrong manner, it will be something leading to a wrong diagnosis as well. Madam, when it comes to that particular tremor, if I'm holding like this the pen, the tremor might not occur. It's a resting tremor. So some people like normal shake their, vibrate their hands, it's like this tremor. When a certain object is taken and when the object is holding, there is a tremor. Is it also a restrained tremor?
Yeah, no, well, it could be, we all have tremor, but it's so very subtle that we don't see it. Right. There are certain medical conditions which can make this tremor worse. We call them exaggerated physiological tremor. So in that instances, when you take the pen, still you might be tremulous. Well, apart from that, there are various other neurological conditions which can give rise to this. But focusing on Parkinson's, it's merely a rest tremor. When you're keeping your arms at rest, you will feel this tremor.
Right. I think that is very much clear for you. Well, there are numerous types of tremors, vibrations simply. We all have, but as Madam said, it might not be seen properly, and not when trying to drag something, hold something, but it's resting. Resting as in not like when something is taken and resting. You just contrast these things when you just consider about this program and you have been keeping touch with IMED with these discussions. Madam, like we discuss about these movement issues, movement disorders, and are there any other related problems, symptoms or whatever it is with these not related to movements?
Yeah, so Charita, let me add a little bit on to movements first. We talked about tremor and we said that it's present only in around 60% of the population with Parkinson's. So what about that other 40%? Well, there has to be something to identify those people as well. So there could be, in addition to tremor, there could be rigidity. One would feel very stiff. They just cannot move their arms away. Again, that's part of the motor movement. They cannot move their arms and legs the way they want to. And with advancing disease, one would get even freezing. They just keep on walking and all of a sudden they freeze. They cannot move. So that is as a result of this rigidity. And the early morning you wake up, you want to get out of the bed, but you feel frozen. Right. So
that particular stiffness, Madam, only in our hands and legs, arms, or any other specific area?
Yeah, so it's commonly in the hands and legs that we experience, but it can affect our speech as well, because speech involves a lot of muscles and lot of motor movements which we cannot see from our naked eye, but it can it can affect any movement in our body.
Right.
So in addition to that, the hallmark of this, that is the most important, the salient feature in Parkinson's is this slowness. So we specifically ask whether the person is slower than he or she used to be. It could be your walking, your talking, your just day-to-day activities that you are engaged with, scraping coconuts, just plucking leaves or whatever you do. So you become slower than who you were. So this slowness, so in medical terms we call it bradykinesia. Brady means slow, kinesia means motor movement. Slowness in this motor movement, slowness in our activities, it's the essential item which is required to diagnose Parkinson's.
Right, that is means, Madam, it's like being slowed as we were previously. It might be in a normal manner that we were working, but like after a certain time with these symptoms and the underlying causes, we are slower than we were.
Yes.
If we're ordinarily slow in normal context, we are getting slower than that. That means relative to a previous condition, not for a specific. Some people are quite slow, but that is not related to this condition, but comparatively for our previous existence, that is what we discuss in this scenario. Madam, we were to discuss about the non-movement related issues.
Yes, so we call them non-motor symptoms, which are equally important. In fact, though we say that dopamine is a neurochemical which is involved with the motor movement, there are a whole lot of other disabilities, problems, difficulties that one would encounter well before the onset of these motor movements. We call them non-motor symptoms. So basically there can be disturbances with the sleep. One would get disturbed sleep, not being able to fall asleep, insomnic. Then there can be a lot of like really bad vivid dreams. They just start screaming sleep, kick the bed partner. So it's often the bed partner who suffers a lot with these sleep problems. So the medical term again for that is REM sleep behavior disorder. And we see quite a lot of people who are like silently suffering as a result of this. So there are treatment options for this. So the whole idea of this is to make you aware of these symptoms. Just don't keep silent and keep it yourself. I mean, there are options that are available for you in such instances. So yeah.
Right, that's, you can understand very well. If you have this particular condition, don't be silent, because there are treatment procedures that is underlying with this type of disorders, so you can relieve all of them. So you can consult a specific doctor, specialist physician in this regard, and you can discuss with them. Madam, like when it comes to that particular discussion, we reminded about the certain disease conditions which will give a mental impact. I think you must be having numerous number of patients with various conditions, how their mental condition behaves. I think that would be important for our audience. If someone, a relative or close friend or any other person dealing with disease, to manage with that.
Yeah, so you're correct. It does affect the mental well-being as well. So there can be psychosis, meaning delusions, that is, we tend to believe on irrational things. So one might start suspecting the spouse having some other affair, or maybe like stealing things. So those are delusions. Or one might start experiencing and complaining about things which are not in real life. You start seeing things which are not really real. So those are visual hallucinations. So those sort of symptoms. Then what is more common than that we see is that they are often with a very low mood. They are often really depressed, kind of. So mood disturbances we see. So one, of course, like we see that not being able to move, not being able to do the activities of daily living in the way that they used to, not having a good sleep. Of course, these are all contributory factors to these psychological conditions. But of course, if they are out of proportion, then they needs to be addressed and treated.
Right, I think that is what is done under rehabilitation processes or something like that. When a certain person is caught with a certain disease, we must not neglect him. If he is having some sort of a disability, ultimately, without, like, we can't manage it with medicines or something like that, but we can train him, we can gain some sort of a benefit for the society. Don't let him like be alone. If someone is suffering from Parkinson's, as madam said, their mental well-being might be affected. So they might see some persons walking here and there. Here one friend is sitting along beside me, and sometimes there might be certain conditions, like there are certain like the bed partner is suffering. So don't make him alone. So you can give this particular attention, because he is suffering from a disease. You can protect him, and you can give the particular so-called mental comfort. So he will, the 90% of that condition might be like, because with his mental well-being coming to a stability, he will be quite comfortable. Okay, madam, when it comes to this disease, what are the proper diagnosis methods?
Yeah, so if we talk about Parkinson's disease, the diagnosis is purely clinical. Clinical meaning based on what the patient comes to us and tells, that is the history, and the examination. So we examine for the things that I mentioned to you. We look for the tremor, we look for the stiffness or rigidity, and we get them at times to write certain things. We observe their handwriting, how it changes, and we can see how they talk, their facial appearance. So all that constellation, all these things in the history as well as in the examination enables us to arrive at a clinical diagnosis. But then again, it might not be as easy as I say, particularly at the very early stage of Parkinson's. So in such instances, there might be a bit misleading, because there are certain other conditions which have these Parkinson's lookalikes. We call them Parkinsonism. Like there can be a little bit of tremor, a little bit of rigidity, a little bit of movement instability. So those are Parkinson lookalikes, but not really Parkinson's disease. So the treatment, it's very much different. So in such instances, we may request certain specific investigations to give us some supportive clues to aid our diagnosis if we are not very sure of diagnosis.
Right, okay. Madam, when it comes to that particular diagnosis, you said there are numerous disciplines. You can just request specific investigations to diagnose some symptoms which is related to Parkinson's, but not that much Parkinsonism. And madam, like when it comes to the treatment procedure, how can you adopt the treatment to that specific people?
Yeah, so treatment to Parkinson's, it's what we try to achieve is to provide the body with what is lacking in it. So I said now dopamine is the main neurochemical which we lack in Parkinson's. So by treatment, what we try to achieve is to give this dopamine in a form which the body can utilize. So levodopa is a method that we give. We have different treatment modalities that are available to administer this drug. So that is the mainstay of treatment in treating this Parkinson's motor symptoms. But then for non-motor, we may give specific treatment based on the problems that the patients encounter. For example, if they have problems with the sleep, then we have to address that. If they have problems with the psychosis, having visual hallucinations, delusions, then the treatment would be different. Then another important thing actually I could mention is this, we partly mentioned actually this involuntary problems, that is autonomic, the things that occur without our control. Say like now the maintenance of our heart rate, the maintenance of our blood pressure in the body, which are very important, but they really occur without any voluntary control. Now in somebody with Parkinson's, that system also gets shut down or gets affected. So one might feel a bit dizzy when he or she stands up from a seated or a supine position, because the blood pressure is not caught up, your blood pressure drops suddenly. There would be erectile dysfunction, because for the sexual functions also these type of nerves are involved. So in those type of patients, we have to address based on the problems that the patients encounter.
Right, okay. So when it comes to those diseases, diagnosis, treatments and a lot of information that we discussed, one, a diseased person or a relative of a diseased person, the most important thing they need to know is that can this disease get cured 100%, or what is the percentage, madam? Is it a maintenance of this condition, or how can we manage that thing?
Yeah, so out of these treatment options available at the moment in the world, there is no treatment which will arrest the disease progression or reverse the disease. But then again, we have enough and more treatment options available to treat the symptoms. So this is a condition which is occurring in rather in adult or elderly population. So we really can target this treatment to make the symptoms cured or to make their symptoms better and uplift their quality of life. So that is, we have to take that in a positive note, because there are treatment options to make you feel better, to let you go ahead with your routine activities of daily living. Yes, that's possible.
Right. So if you are suffering from this Parkinson's disease or one of your relatives, there are possible treatment opportunities you can deal with, and managing the symptoms, and the most important thing is that you can continue, you can proceed with your normal routine. Might be there are some changes that you have to make, but that's all we have to do, and that is possible in this context and with this modern technological advancements. So we discussed about Parkinson's disease, the causative factors, the symptoms, diagnosis, and other related areas, and specifically the mental aspect of this thing. And when it comes to this disease, we tend to isolate those people, and those people tend to be isolated. We must not do, as our madam said. So madam, thank you very much for joining us with a meaningful and a wonderful discussion. Dr. Kumarange Vithanage, consultant neurologist and senior lecturer of the Faculty of Medicine, University of Colombo, for joining us with this program, IMED. So thank you very much, ladies and gentlemen, for watching IMED, and stay tuned with more programs in the future as well. We'll be discussing numerous disciplines in the future as well. Thank you very much. Have a pleasant day.
Amidst wireless